Okay. Hello, everyone. Salam and peace. Welcome to The Real Diagnosis. I'm your host, Dr. Taher Ahmed. On today's show, we're going to be talking about global health in the midst of a pandemic. Our guest today is Dr. Zahir Sahloul. He's a critical care specialist at Advocate Christ Medical Center, and he's an associate professor in clinical medicine at the University of Illinois at Chicago. He has spent a lot of time doing medical relief work and supporting civilian populations in the midst of crises, humanitarian issues, and devastation in various areas, including Syria, Yemen, and all over the globe. In 2016, Dr. Sahloul was awarded the Chicagoan of the Year for risking his life on medical missions to Aleppo in Syria during the Syrian civil war and the humanitarian crisis. He's received countless other awards and received UNICEF's annual humanitarian award in 2017. He's the co-founder and president of Med Global, and that is an organization that serves humanitarian needs across the globe, an organization that I have worked with in the past. So I'd like to thank and welcome to the show Dr. Zahir Sahloul. Thank you for coming on.
Oh, thank you, Dr. Thaer. Thank you for having me. I'm really honored.
Thank you. So I wanted to jump in with recent current events. Obviously, what happened in Beirut a couple of days ago was incredibly devastating. The numbers are going to continue to rise, but the most recent thing I saw was over 130 people have died. There was a explosion that occurred, and there's still a lot of vague details. As somebody with the experience that you have, when you see a situation evolving like this, that looks like it's going to turn into a humanitarian crisis, a place that needs support. What are some of the things that you think of, that you're analyzing, some of the things that you are thinking of before you start to get ready to do the work?
Um, I mean, there's few things that comes to mind. Thaer. The first thing that this is really big disaster. Understanding the context of Lebanon, and every country is different. You know, if you have this bombing happened in France, it's different than Lebanon, it's different than India, it's different than Colombia. So you have to understand the context of every country that goes through a disaster like this, which means that you have to be a globalist. That means understand what's the Middle East, what's Lebanon, geopolitical issues in Lebanon, the fact that it's going through rough time because of the deterioration of the economy, the collapse of the banking system, the COVID have affected the population really bad. There was some unrest in the last few months because of the young people wanted better governance. The government is famously corrupt in Lebanon. And of course, you have a lot of parties that using Lebanon as a proxy place for war. Iran, Israel, of course, Syria, other places, other countries. So understanding this context is very important. Understanding the scale of the crisis and its immediate impact and long-term impact is
Right.
very important. You mentioned the death. You mentioned the injured, 5,000 injured. Displaced, 250,000 people were displaced. The economic impact is $15 billion of damage. So all of this is huge, including two major hospitals in Beirut area. The
Right.
hospitals in the area is now stretched very thin. So the immediate needs are attending to the wounded, to doing surgeries, providing humanitarian assistance to the people who are displaced, and then long term would be rehabilitation, rebuilding hospitals, taking care of the people who lost their breadwinners, and things like that, and rehabilitation of homes and rebuilding, which will take going to take a lot of effort and money.
And so this is something that you've been through before. It's something that you've had to tackle. And I want to touch on that. A lot of people are aware that there are organizations that are working on the ground and on a lot of different places, but specifically in Syria, with the devastation and the magnitude of what's happened there over the last 8 years, um, how how was it even possible to get work done there? It seemed like the geopolitical context wouldn't allow anybody from the outside to kind of come in and do any work. There's so much violence. The borders seem to be closed off. There's this massive refugee migration going on. When you during that time, how are you able to even get in, and what are some of the steps? I would love for you to share with our viewers just some of the background. What happens there?
It's not easy, but it's doable. And I believe, frankly, as a Muslim, that if you try to help others, then God will open doors for you to help. And no matter how mounting the challenges and the obstacles, then you can overcome them. And I have countless stories about how things that looked like it's impossible, then because of the will of Allah subhanahu wa ta'ala and the people,
Yeah.
then things happen. And then you will feel that you are able to help people, no matter how challenging the situation. So, I mean, you mentioned Aleppo in the beginning, in the introduction.
Yeah.
You know, Aleppo was under siege.
Right.
The only road leading to Aleppo was being bombed and sniper attack. So three physicians from Chicago, including Dr. John Kaler, who's 70 years old, pediatrician from Chicago, who has no connection to the country whatsoever. He wanted to help the children of Aleppo after one of the doctor was killed while he's on duty in the hospital. And Dr. Sam Al-Attar, who's orthopedic surgeon in Northwestern University, we went to Aleppo, and that was the probably the riskiest medical mission that we had.
Right.
And any minute we could have been shot, or our car has been hit in the road to Aleppo. We stayed under siege in the city with the population for 4 to 5 days, working in an underground hospital. Every minute you hear the sounds of bombs and
Wow.
going in the distance. But you know, we were able to help. You know, the people that we were able to help, and the fact that we were there, coming from Chicago, it meant the whole world to the doctors and the nurses in Aleppo, that you have these three physicians. Even that maybe our medical work did not affect hundreds or thousands, probably few patients, but the fact that we were there and that we were witnessing about the atrocities and what they're going through, it meant a lot. And that was translated into a lot of media attention after we came back, and a lot of advocacy and tons of money that poured to help the people of Aleppo. So
Right.
things can happen if people wanted to help.
And so you're able to get in there at a time when, as you mentioned, the Aleppo was under siege by government forces, and so it didn't seem like you were coordinating with the blessing of the government. It wasn't like you were a guest of the government there. You were, every step of the way was you just trying to get in there to help people. And so, how do you even calculate that risk in your mind as you're embarking on this journey? What's going through your head?
Um, it's different calculation, Thair, and of course you have to trust in Allah subhanahu wa ta'ala. You take the advice of people. You need to know the landscape. I think it's very
Yeah.
important for people who want to go into mission, into disaster region, to understand who are the local actors and to coordinate with them, because otherwise you're going to risk your life unnecessarily, and that is not good. So, I mean, I've been going to Syria for 10 years. I mean, that was not my first medical mission. I understand who are the players, and who is in control on which section of the governance, who is in control of the border. You need to collaborate, coordinate with the Turkish authorities to get into Syria, because you have to go through the Turkish border. So that took like 3 months to get that permit to get into Syria. You have to coordinate with the hospital that will be receiving you, so they can have a car waiting for you, and also with the armed groups that are playing or controlling that area, to get safely. Otherwise, you will be shot at by many actors. And
Right.
of course, there's always risk, but at least you minimize the risk by knowing who's who and who is helping you, and working with the people that you trust.
Right.
Uh, so that's the main thing that you, of course, and then you put the trust in Allah subhanahu wa ta'ala. You pray, you make dua, you ask people to make dua for you, and things will happen. I feel frankly safer in Yemen, in Gaza, in Syria, in Lebanon
Right.
than sometimes in Chicago.
Right. So that's an interesting point, because you mentioned that there are so many actors at play here. There are different people every step of the way, and I wonder if people realize that. I think so many people want to help, and they always wonder, okay, I want to give some money, I want to help this cause. I know that there's a struggle and that there's a crisis going on. So I guess my question for you would be, when you go to areas like Gaza, you go to Yemen, you help the Rohingya refugees in Bangladesh, there are all these projects going on. How do you find people to trust? What's that process like?
So, for example, I'll give you an example. Yemen, for example, I went to Yemen 4 times. The first time was the most difficult because I didn't know what to expect. But I worked through a friend who knew the Yemenis and the area that we went to. It took us a lot of preparation to plan for this, but it was successful. And I got to know the people in Ma'rib city, which is one of the major cities in Ma'rib. And through this connection, the first connection, when you see persons and you see eye to them, then you know that this person is trustworthy or not. And in the Arab world, it is very important to look into the eye of a person and talk to them and to see whether this person you can trust in the future. And when you build this relationship, the first relationship, it will help you a lot 10 years even from now. And I've seen that in my humanitarian world work. It's a miracle that sometimes you encounter one person 10 years from now, let's say in Syria, and that person will help you in Yemen after 10 years. And so it's one degree of separation, as I say, that people know people that you know. So every time you want to go to a new place, you contact the people that you got to know in other places, and they will know someone who can help you. So last time we went to Yemen in Hadramaut in November of last year, we had 22 physicians from 8 different countries. And it's through the first connection that we established 3 years before in Ma'rib. So things work that way. Of course, we had to have security. We had to make sure that the local authority understand that we're going. We had to go through the Yemeni embassies to get visas. That travel to Yemen by itself is very challenging because there's only one airline. So there's all kinds of logistical things that you have to take care of before you get to an area like Yemen.
It's almost like you create your own ecosystem, your own community by doing this.
Yeah.
On that note, we're going to take a quick commercial break. When we come back, we'll talk more with Dr. Zahir Sahloul, and more about the medical missions in the global health world.
Your eyes.
Assalamu alaikum everyone, it's your brother Zain Bika from South Africa. One of the first educational programs ever produced for Muslim children was the ever popular Adam's World series. The colorful and comical Muslim puppets stole the heart of a generation. Sound Vision will be releasing brand new episodes of Adam's World with the launch of a Adam's World app. Subscribers will enjoy new Adam's World episodes as they are released, as well as all the classic episodes of Adam's World. So visit adamsworldapp.com now to learn more, subscribe and enjoy new adventures of Adam and his friends. And let's keep helping tomorrow's Muslims today. Assalamu alaikum.
It's Adam's World. Believe me, there's a lot to see. Bismillah. Let's explore.
Welcome back to The Real Diagnosis. I'm your host, Dr. Thair Ahmed. I'm here with our guest, Dr. Zahir Sahloul. We are talking about global health in the midst of a pandemic. And Dr. Sahloul is sharing some of his experiences working in this humanitarian world and providing care. The one thing I want to ask you is before we get into the COVID pandemic and how that's affected some of the work is, how do you get a buy-in from the people from the people who are affected by these tragedies? Oftentimes, these are refugees, or these are people who are affected by this crisis. They have been taken advantage of. They are going through incredibly difficult times, and to come in it and say that you're an advocate for them, that you would like to see what their needs are, they need to establish some trust. There needs to be some trust there before they willingly kind of. How do you gain the trust of the people that we're trying to help?
I mean, that's a good question, and it's very important, because without the trust of the population that you serve, whether it's your patient in Chicago or a patient in Yemen or a physician or nurse in Bangladesh, it's very difficult to work. Um, I mean, I would say that if you come from distant land, from the United States to a country that has limited resources, or that is going through rough time because of war or natural disaster, and you bring with you things that are needed based on the real need, and you don't have other agenda, and I think this is very important. I mean, your intention should be pure to help the population. I think people will sense that. And also, you do things right. You do things right. That mean you assess the situation in the field. You understand what are the real needs. And when you have a large number of refugees in the Rohingya population, the needs are different than if you're going to Yemen. And if you're going to Yemen, the needs is different than if you're going to Colombia to help the Venezuelan migrants.
Right.
So every place is different. So needs assessment is very important. Your intention is very important. You have to abide by the humanitarian principles, which means that I'm going to go and help everyone based on the need, regardless of their ethnic, religious, political affiliation. That's very important. And
Right.
that you have to be neutral. We call it medical neutrality. You have to be impartial. You have to be independent. That means independent from the agenda of other actors. Everyone has their own agenda, even the people sometimes that you serve. But you're
Right.
going there to help people who are in need, and I think people will sense that, and you can build trust based on that. And also, you have to make sure that you are going and to meet two conditions. The first one, we call it localization. Localization, that means you have to listen to the local people, because they understand the need, and you have to empower them by having their voice heard in the decision making. So localization in global medicine is very important, in global health in general. The other thing is sustainability, because you don't want to go there and give some samples and leave. That's really sometimes is even more destructive, and many medical missions are like that. So there's a lot of criticism in the literature about that. So you want to work with the local population to build resilience on the long term by focusing on training, giving them technology, providing them with technology that will last for a long time, medical supplies that they will use after you leave. So sustainability is also a very important condition that you have to meet.
And that seems like an incredibly big task. And it seems with your organization that you try to address the needs that are immediately there, but also you're working on these long-term things that people can benefit from, that somebody can come in there and there can be empowerment of the local population that exists. And so I wonder if when you have a big task like that, how are you measuring the level of success that you're having with each project that you're doing?
That's probably one of the most important and difficult aspects on how to measure your impact. Um, and without measuring your impact, I can tell you, oh, we had the most successful medical program in Yemen or in Sierra Leone or in Sudan, but you have to measure it. There are simple things, for example, to measure how many people they benefited from. Let's say that you distributed PPEs in Sudan. How many healthcare providers that received PPEs? That's one objective measurement. If you're training physicians, you need to make sure that they change their the way they practice medicine. They incorporated the training of portable ultrasound, for example. So you have to do some survey before and after. So there are certain things that you can do to be a little bit more objective in measuring the impact. But it's very important in every program that you do or project. The measurement, the benchmark that you have to use are different.
So now in this global pandemic that we're noticing with COVID affecting the entire globe, there has not been I think, a single area that has not been affected either directly because of the virus or because of the implications of the virus. What have you, I mean, you guys, your organization is essentially in so many places. What are some of the challenges you've had as a result of this pandemic? On what levels are it affecting the populations that you're serving in the areas that you're working?
I mean, there is huge changes in global health and international NGO, the way they practice because of the COVID pandemic. And these changes are long lasting beyond this year or next year. So sending medical missions will not going to be the same way like before. The travel restriction will make it very difficult for physicians like me or you to go to areas like Gaza or Lebanon or Bangladesh or other places because of the risk of contamination, because the need for quarantine and so forth, risk of exposure. I'm sorry. Especially that the United States is one of the countries that had one of the largest COVID patients in the world. The second thing is that things will be done differently. So we have to depend on online training. We have to depend on webinars to provide education and training. And you have to send medical supplies and PPEs and ventilators and oxygen without you being in the field. I mean, you have to depend on your staff members in the field. So we have staff members in Yemen, in Lebanon, in Syria, in Bangladesh, in Colombia, who are doing field assessment and telling us this is what's needed right now. Can you help? So you have to do that. And the third thing that you have to understand the landscape a year from now or 2 years from now, so you can plan accordingly. Putting strategy for continuation of your work is one of the most important and difficult thing in global health. So understand the strategy. You have to understand the threats, the opportunities, how things will change in the future in the area that you are serving, so you can be adapting to this. And that means you have to be very agile organization. Agility is very important. Agility means the ability to make changes quickly as an organization is very important in this environment that we are living through.
But all of that sounds like it's going to be that the cost of delivering this sort of help it increases for every single participant that's involved. And I wonder, I guess I would want to ask you, what have you noticed in terms of these host countries or the larger NGOs, larger organizations? Does it seem like some of their resources are being diverted to dealing with this pandemic, and perhaps some of these refugee populations or these populations affected by the violence or natural disasters, that there's going to be some sort of neglect as a result of this?
Definitely. Okay. Definitely there will be more neglect because it's very difficult for the international community and the UN to deal with issues related to disaster if you have the pandemic still going on. The resources are limited, the disasters are increasing. So the need is higher than the supply. We are seeing that now in Yemen, in Syria, where you have less appetite for donations than in the past because people are busy with the impact of the pandemic on their backyard, including the United States, which used to be the largest donor in the world for humanitarian assistance. We continue to be the largest, not per capita, but as a whole, but much less than before because we're busy with the COVID, and that will continue. So that means you have to, and I think this is the one of the most important thing that we as physicians, as healthcare workers, have to learn, because we don't learn it in medical school or training, which is dealing with limited resources. Right. And how can we manage with the resources that we have to provide as much health as possible to help larger number of population? Today we had this discussion in my hospital that we spent probably $10 million to take care of 2 patients on ECMO related to COVID. These $10 million would have saved the lives of million people sometimes in some areas in the world. Right. So this reallocation of resources is very important. And so you have to use different principles that we used to do in the past. Right. Disparity, by the way, which is now everyone talking about healthcare disparity. By the way, the vision of MedGlobal is to reduce healthcare disparity at the global level and also at the national level. Everyone now understands the impact of disparity on COVID, because people who have less access to healthcare and testing and nutritious food are suffering more because of COVID. They are dying more, and this is also highlighted at the global level.
Of course. We have about 30 seconds before I let you go, and I would just love for you to share with the audience what they could do to help. How can they support, the different organizations like Med Global? What are some of the things that we can do to get our hands dirty and essentially get involved in helping support, global health projects?
I think paying attention to global issues is very important. We tend to be self-centered in the United States. We have to look at the rest of the world. Doing things that you have done, Thaer, like donating to organizations that are doing good work, including Med Global. You can donate through www.medglobal.org. We have now campaigns to help COVID patients in Syria who are struggling to breathe. We have a campaign to help the Lebanese victims of the bombing. We have campaigns to help the Rohingya refugees and others. Of course, Gaza, we have an active campaign. So helping by donations if you're not able to go as a physician or a nurse. And also try to look at other programs that you can help through telehealth, through training from distance. Every physician, I believe, in the United States should be able to do that. And you have the time to do it. And if you do not do it, I believe that you are responsible for what's happening in the rest of the world. We are responsible if a child in Yemen or in Syria or in Gaza or in Venezuela is dying because of hunger or because of the disease that is preventable.
Well, thank you so much for coming on, Dr. Sahlu. Thank you for all of the work that you're doing. And I hope everybody can come away with an opportunity now to participate in the responses and in the projects. Thank you very much.
Thank you, Thaer, for having me. Thanks. Assalamu alaikum.
Wa alaikum assalam. We'll take a quick commercial break and we'll talk about what's in store for next week.
We are Justice for All. Headquartered in the heart of downtown Chicago, Justice for All is a global humanitarian initiative dedicated to raising awareness for human rights concerns impacting vulnerable minority groups. We promote policies that protect religious freedom, address the root causes of mass displacement, and recognize the plight of refugees and forced migrants. Our diverse team of staff and volunteers, led by Imam Malik Mujahid, work tirelessly to help Justice for All achieve their goals. Past campaigns covered a wide range of humanitarian concerns. Through Bosnia Task Force, imams and leaders of Chicago's Muslim community worked to ensure Bosnia became a top national issue. This led to life-saving American policies in Bosnia. A key accomplishment was helping to get rape declared a war crime. Initiatives also included Kosovo Task Force, Central African Republic Task Force, and Flint Coalition, which brought awareness to the water crisis affecting the people of Flint, Michigan. Highlights of our work include supporting Black Lives Matter, Parliament of the World Religions, addressing climate change.
So wasteful consumption starts the ruthless production, and that's where we need all the fossil fuel in the world.
And prominent media exposure.
This is Imam Malik Mujahid, President of Justice for All.
And I'm the Director of Outreach for Justice for All.
And that's why we need to go back to what worked.
Today we're demanding an apology from the CEO of Costco.
The Chinese crackdown on Uyghurs and other Turkic people has only gotten worse.
Current programs such as Burma Task Force advocate for the rights of Rohingya refugees in Bangladesh, internally displaced populations, and all those denied freedom of movement and at risk of starvation. Through this, we mobilize thousands of calls to elected representatives. This paved the way for the U.S. to increase funding for Rohingya refugees from $30 million to over $600 million. Two of our documentaries were featured on international news outlets. The Rohingya People, A Slow-Burning Genocide on BBC World News, and Rohingya Refugees Tell of Massacre was featured on CNN. We've organized rallies, UN mission visits, expanded presentations on campuses, promoted research and report writing, outreach to think tanks, media, and other influencers. Faith Coalition educates about the Rohingya genocide and crimes against humanity faced by ethnic groups in Burma. We've traveled to refugee camps, convened a meeting of Karen, Kachin, and Rohingya leaders, both to encourage cooperation and to guide them in congressional outreach. We organized Rohingya Advocacy Day. This led to over 100 participants visiting the offices of 60 U.S. senators and congressional representatives. Free Kashmir advocates for the people of Kashmir. Long-term goals include the call for self-determination, the end of the Indian military's occupation of the territory, and raising awareness of Kashmiri issues among the American people. After the August 5th reinvasion of Kashmir, we organized national protests in front of various Indian government buildings, partnered with Stand with Kashmir, and launched a petition condemning the Gates Foundation's decision to present Prime Minister Modi a humanitarian award. Save Uyghur informs Muslims and neighbors of other faiths about the ongoing cultural genocide of Uyghur Muslims and mobilizes public support. Our projects include boycotting Chinese products with our Fast from China campaign, pushing Bill S-178 in the Senate, and organizing a nationwide protest of Costco. Together, we can continue to stand up for justice. Justice for all.
Welcome back to the Real Diagnosis. I'm your host, Dr. Tahir Ahmed. We just had Dr. Zahir Sahlul, a major player on the global health response level. His organization, Med Global, is running various responses to humanitarian crises all over the world. And this is an opportunity that I wanted to highlight in regards to what's happening. When we talk about the global pandemic, every single person in the world has been affected by this one way or another. The pandemic has affected millions of people, not just directly through contracting the virus. It's not just about getting the virus. It's about every single sector being affected by that. And if you think about how people who are in countries who have not had a very serious outbreak, they are also affected by this. And they've been affected from a political perspective, they've been affected from a financial perspective, and they've been affected with their own reckoning in terms of how to attack a virus if it does enter their country. There's a lot of fear out there. There is a lot of concern, and all of this is just so new. None of this was something that anybody was expecting to happen. If you look at the estimates from economists, the pandemic, at the very minimum, for countries who are responding well to it, is going to drop a GDP by 10 to 15%. And a GDP essentially is just a marker that looks at how strong or how healthy your economy is doing. And so if right away, off the top, you're hitting an economy, these are effects that we're going to be noticing for a long time. And the reason I emphasize this, or I want to bring this up, is not to say that this pandemic is crushing so many different aspects of life, because I think people know that. I think people understand that this is very serious, and that the implications of what's happening now with the COVID pandemic are things that we're going to be dealing with for decades. But I think about these vulnerable populations, the Western world has institutions in place to tackle the COVID pandemic, right? I live in America, and we have very advanced hospitals. We have very well-educated doctors and subspecialists and subspecialists. There are ways that we can deal with this. We have the best of the best dealing with this, and even we are struggling. Even we are having a tough time with this. Well, what about the people in the Gaza Strip who have been under a siege and are not allowed to import or export something without explicit permission? And that process is incredibly difficult. What about the people in Syria, the refugees in Europe, the people in Yemen, the people in the DRC, the people in Sudan, the people in Libya, the people in Egypt, the people in Bangladesh, the Rohingya? Uh, there are so many places that have had these really horrific things happen to them. And then on top of that, you're adding the COVID pandemic. This is serious. Their lives were already incredibly affected by what was going on around them. And now for this to be added on top of that, I think is something that many of us are concerned about. And I appreciate Dr. Zahir Sahlul coming on because he affords us the opportunity to do something about that. It's extremely difficult to sit there and not be able to do something that you know is wrong. You know that what's happening to these people is unacceptable, and you know it could easily have been you, and so you want to be there in solidarity and you want to advocate for them. And so people like Dr. Zahir Sahlou have given us an opportunity to do that through their organizations. There are several organizations out there. I encourage everybody to take a look, and I hope, God willing, inshallah, that we can all do our part, regardless of how small or how large it is, because I think ultimately it will have an impact if we're all thinking about doing that. With that, tune in next week to Real Diagnosis, another show planned. We thank you for joining us today, and good luck and goodbye. God willing, we will see you next week. Salam and peace.